students, today we are going to study about the spleen. So this is spleen in my hands. So first of all, the spleen is present on the left side in the abdomen. Okay, so if you see the spleen in situ, this is spleen and it is present on the left side in the abdomen. Okay, so organs which are present on the left side, we should keep them in anatomical position. We should keep them in the left hand. So I will now hold the spleen in my left hand. Okay, now I will identify the borders, surfaces, ends of the spleen. So spleen has two ends. This is the anterior end, which is broad. This is the posterior rounded end of the spleen. This is the superior border and this rounded is the inferior border of the spleen. If you see the superior border of the spleen carefully, you will find notches along the anterior aspect of the superior margin or the superior border. These notches represent the incomplete fusion of spleniculi during development. The spleen develops in the dorsal mesogastrium in small spleniculi, and then these spleniculi fuse from the lower end to the upper end. So final fusion occurs along the superior border. That is why the spleniculi which do not fuse completely show notches along the superior border. So you have to identify the superior border by the notches present along it. Okay, so we have identified the anterior border, the posterior border, the superior border which is notched, and a inferior rounded border. Apart from these two borders, there is another incomplete border known as the intermediate border. So this is the intermediate border. This area represents the hilum of the spleen, where splenic vessels either enter or exit through the spleen. This intermediate border is present only in the posterior to the hilum. Okay, and this is produced because of the wedging of the spleen between the fundus of the stomach and the left kidney. Okay, so this border is not present in the entire length. It is just present posterior to the hilum of the spleen. So this is the intermediate border. Now the surfaces, the spleen has two surfaces. This is the lateral surface and this is the medial surface. The medial surface is also called the visceral surface because it is related to different abdominal viscera, and this surface is known as diaphragmatic surface because this surface is related to the diaphragm. Okay, so if you see the shape of the spleen, this spleen is wedge shaped. Okay, so now when I have identified all the borders, ends and surfaces, now I will try to keep this spleen in anatomical position. So to keep the spleen in anatomical position, I will keep my thumb on the superior border, my little finger along the inferior border, and the three fingers along the diaphragmatic surface of the spleen. These fingers are representing the 9th, 10th and 11th rib. So the long axis of this organ is present along the 10th rib. Okay, this anterior end is present at the level of mid axillary line, and this posterior end is close to the vertebral column. Okay, so now if this is the body, I will keep this organ on the left side. I will keep this organ on the left side along the long axis of the three ribs like this. Okay, the posterior end close to the midline. This posterior end is directed upwards, backwards and medially, and this anterior end is directed downwards, forwards and laterally. Okay, so this is how we keep the spleen in the abdomen. If you see the spleen in situ, so this is the spleen in situ, and you can see that this spleen is related to the diaphragm. So this is the diaphragmatic surface. This surface is related to the stomach, the kidney and the colon, which I will tell you later. So, and then you can identify this superior border through the notches present in the anterior part of this border. And then this is the inferior border. And then this, as this spleen is very small, you cannot clearly identify the intermediate border. To identify the intermediate border, you will see this spleen. So this is the intermediate border. Okay, so this is how we hold the spleen and keep it in anatomical position. Now the surface, after the surfaces and borders, now the relations of the spleen. Okay, so this spleen on the visceral surface is related superiorly. This impression is for the fundus of stomach. Inferior to the intermediate border, this impression is for the left kidney, and anterior to the hilum, this area is related to the left splenic flexure of the colon. So majorly it has three visceral relations: superiorly the fundus of the stomach, inferiorly the left kidney, and anteriorly the left splenic flexure. This portion is the hilum. The hilum of the spleen is related to the tail of pancreas. Now we will see these visceral relations in situ. So can you see this impression? This impression is the impression of the fundus of stomach. This part is the fundus and it is related at this place. Okay. Then this portion is related to the left kidney. Okay. So this structure, my finger is pointing towards, is the left kidney. Then anterior to the hilum, this area is related to the left splenic flexure. Can you see the left splenic flexure? This area is the left splenic flexure. Okay, so this portion is related to the colon. Okay, then can you identify this viscera? This is pancreas and this is the distal end of the pancreas known as the tail. This tail of pancreas is related to the hilum of the spleen. Okay, hilum of the spleen. Now see this specimen. I've kept this specimen again in anatomical position. Can you see the vessels running towards or away at the hilum? This is the splenic artery. Okay, because it has a patent lumen. Then this flat vessel which is exiting from the splenic hilum is the splenic vein. Clear? Can you notice the formation of portal vein? See? See? This is the splenic vein. This is the superior mesenteric vein. Then this is the portal vein. And can you notice this small vessel? My finger is pointing towards. This is the left gastric vein draining into portal vein. So portal vein is formed behind the neck of pancreas by the joining of the splenic vein and superior mesenteric vein. So this is the portal vein, splenic vein and superior mesenteric vein. Okay, this is the splenic artery. So close to the hilum, this spleen has two ligaments. Gastrosplenic ligament. Gastrosplenic ligament will connect the spleen to the stomach, and in gastrosplenic ligament run the short gastric arteries which supply the fundus of the stomach and the left gastroepiploic artery. Then in the lienorenal ligament run the splenic vessels and the tail of pancreas. So if we see in situ, see these branches, these are the short gastric branches. These are supplying the fundus of the stomach, and the left gastroepiploic artery, see the left gastroepiploic artery supplying the along the greater curvature of stomach. Then this tail of pancreas along with splenic artery. See, splenic artery runs along with the superior splenic vein along the superior border of the pancreas. Okay, so tail of pancreas and superior mesenteric vessels are contents of the lienorenal ligament, and short gastric arteries along with left gastropubic artery are the contents of gastrosplenic ligament.